welcome to the show, Mr.
Thank you,
Fantas.
Carol.
How are you
Thank
doing?
you for hosting me.
Thank you so much for being here.
Kindly
Kindly start by telling us a brief background of the HAKI Foundation.
Yes, as you've correctly put it for the audience, my journey began when my mom was struggling with kidney failure. And in that period I saw, because I was young, I saw my family struggling. I saw them, their energies being drained. And I realized it was far much bigger than just the need to have the food on the table or the money for treatment. There are other effects that really needed to be tackled in a different way. But basically my trigger was really when I saw my siblings having done all they could do and together with their friends. And when I started seeing even our friends, as much as they cared for us, after 3 years, I realized it was becoming difficult even to do harambes, really. As much as people would want to come and contribute, they didn't have that money. So one day I sat down and I asked myself, what can I do? What would be my contribution? First to my mom, but also to challenge my fellow youth. So that's how the idea of doing the work came into being, and other friends joined me, and we were able to complete the work successfully. But then something happened. It became an eye-opener. First, I was exposed to see that it was not just about my mom. There were so many people out there that were suffering from this disease, and there were many other factors in place. And people also got noticed of this young person who was trying to do something. And that's when our community started forming, and we started thinking of how we can be able to address these issues. But basically, some of the motivations were the need for awareness, the need for information.
So to begin with, what would you say of kidney problems in the country? Are they too many? Are they reducing according to what you receive at the HAKI Foundation?
First of all, I must admit, when we started, the first time that we found ourselves in this situation as a family, it was very difficult. Because at that time we didn't have many individuals who were willing to stand up and be counted. We didn't have many people who were talking about it. We didn't have many channels of information like we have now.
Today.
You know, we have Facebook, Twitter, information is available. But then I must admit, you know, then now we have many people, not just me, who are talking about this, who are committed. Every single day they are working to try and find solutions. The government is doing a good job. It's good to be appreciative. We've seen people are able to access transplantation. Constantly we are seeing improvements. And I think globally now there is an appreciation that the non-communicable diseases cannot be ignored. So there is that shifting, and definitely there's going to be focus. However, it's also important to note that now we have many more young people getting these diseases. And so the need for us to increase our activities and to go out there and encourage people to do actually have frequent medical checkups is very important. Many people who have been diagnosed, it's because they went to the doctor. I'll tell you this, very many people don't want to go for medical checkups. And the excuse they'll give you is that consultations are expensive. And I agree, you know. Probably you'll be charged 1,000 depending with where you go. But in the long run, you can't compare. You can't compare. And you'll be amazed, as much as kidney failure is a very serious disease, you'll be amazed if you're diagnosed early enough. Simple things like being put on the proper diet can put these ailments away. And so we really need to make people understand the dynamics. And the other thing is, of course, you find that we are in a culture where people prefer to use a lot of painkillers. And unfortunately, painkillers mainly are one of the factors that lead to kidney diseases. So we're encouraging people to seek constant medical checkups. And to exercise, of course, observe your diet, and especially young people like us. I'll tell you, we all agree that we need the proper diet. That's for sure. Talk to anyone out there, they agree. But the problem is the time that we give ourselves. We always believe that I'll do it when I get a little bit older. And before you know it, you're in your 40s and complications are starting to come up, and you start wondering, when did this happen? You know, it happened when time is not a respect of persons. So again, that's something that we want, especially the young people, to understand, that we don't have all the time, and our old age is going to catch up with our youth. So it's very important to do some of these simple, take some of these simple measures as early as now. Yeah.
So let's now, I would like us to first go to the deeper part of the kidney. Let's start by, what are the main functions of the kidney in our body?
Yeah. Before I even respond to that, allow me to show you something. Just to give you a perspective of why what we're doing is so important and why we are encouraging many people to go out there and seek information. You'll be amazed. The most basic information, for example, allow me to ask you a question.
Do.
You of course know how many kidneys you have. I believe you know you have two.
Two of them.
But where are they located?
This side and this side.
Where? Here?
No, on the sides, almost at the back, but on the sides.
Yeah, good. You'll be amazed. We ask people those questions, and guys are like, they start looking for their kidneys, and they almost start to feel like they don't have kidneys. At one point, we usually have peer educators outreach programs, and I remember one of the scenarios that I've ever enjoyed. We had this young lady who said, you know, I thought I have like 2 kilograms, you know, in terms of weight.
Yeah, of the kidneys.
Yeah, we were like, really? But anyway, the basic functions of the kidney, the most important one, is that they clean the toxins from our bodies. They're involved in the production of hormones. They regulate high blood pressure. Those are some of the basic functions. Now, in terms of what we need to do to make sure that we have happy kidneys, as we usually call them, the number one thing that is very important is to drink a lot of water. Because we've said one of the functions is that they clean the toxins from our body. They excrete waste. And so water facilitates that process. Everybody can access water.
Yes.
It's free, and it's good to look at it this way. If you're cleaning this room, if you use one bucket, and another person has another room and uses, say, like 100 buckets to clean the room, then definitely
it's going to be different.
Exactly. That's really the picture. Or the other analogy that I love is that of a car. You know, people who have cars, they are so passionate. They always check. You know, if you service your car, say after 3,000 kilometers, by the time it's hitting 3,000 kilometers, they know it's time for us to go for servicing. Why can't we do the same with our bodies? It's the same system. We ignore going to service our bodies. We ignore the right diet. We ignore to talk to the caregivers, the professionals, the guys who are in nutrition. We ignore to talk to doctors. We ignore to consult. We pass by ourselves. You know, literally we pass ourselves. And what happens is that when now our kidneys get strained, so we get into hypertension, and because of our ignorance, because we are not servicing our body, we are not going for medical checkups, our hypertension goes out of control. And so it strains the kidneys, and eventually they fail, and you're in trouble before you know. It's not just knowing the functions. It's also important to know that we must embrace, allow me to say, that culture of servicing ourselves.
And so what are some of the symptoms that people should look out for to know if they are suffering from kidney problems?
And unfortunately, I must admit the challenge with the symptoms with kidney failure, they are not so direct. You realize from the conversation that I've just had with you, in most cases, it's not just direct, you know. So you'll find that the symptoms are associated with other things. So you find that the symptoms you have for hypertension or diabetes are pretty much the same symptoms you have. You might find that you have swollen feet, fatigue, headache. But I think the most important symptom for people with kidney failure is a metallic taste. You know, if you find that you have a metallic taste, then that's an alarm for you. That's an alarm for you that in most cases that comes along with kidney failure. What
tests are carried out to determine if you have problems with your kidney?
Yeah. At the basic level, actually, it's very simple. When you walk into a clinic, the tests that they do for hypertension and diabetes, the first thing, actually, that's where it begins, you know. They'll check your high blood pressure, they'll check your whether you're diabetic, then they'll check your urine. So the tests are very basic. But of course now, if the doctor finds that, say, you have potassium in your urine, then he will advance to other major tests to verify. And I think, again, allow me to stress, that's why it's so important for us to go for regular medical checkups. For this simple reason, by the time you are getting those symptoms, it's an indication that something very serious has happened.
This is happening.
Kidney failure is not something that happens just one day. It happens over a long period of time. Yeah.
And so tell us, what's the difference between having a dialysis and having a transplant?
Dialysis supports the functioning of the kidney, but externally. So your blood goes to the system, it's cleaned, and it goes back. And again, transplantation is where you're done an operation and
a kidney is given
to you. Now, the benefits of transplantation is that it removes the burden of dialysis, because dialysis you spend a lot of time,
a lot of money.
And a lot of money, yes. And of course, transplantation again gives you your life back, literally. You have an improved quality of life. You're able to go back to the things that you do.
When I was admitted, it costed about 3.4 M. So the much I had in the store, actually, I have nothing which is left for a rainy day. In a week, I spend about 20,000 here. So I think the best option is to go for the kidney transplant. So I think that I can also go for that option.
And are there laws that govern kidney transplantation here in the country?
As I've mentioned, we are really coming from far. But at the moment, for example, you are not allowed to donate. I can't donate my kidney to you just because you're my friend. We have to be related by blood. And it's not an easy process as at now. Of course, there are the logical aspects to it, that some people would want to sell their organs.